outbreak, or are you pretty confident that these are simply cases of the small, very small number of serious cases of coronavirus which we do see in children?
I'm very worried about the latter, and we are looking into it closely. I'll ask Steve to answer on that.
As you've referred to, we have become aware in the last few days of reports of severe illness in children, which might be a Kawasaki-like disease. So Kawasaki disease is a very rare inflammatory condition that occurs in children. The cause is not often known. It can be related to a number of things. So it's only in the last few days, as I say, that we've seen those reports, and I know you reported that in the Health Service Journal this morning. So both Chris and I are aware of that. We have asked our experts, so I've asked the National Clinical Director for Children and Young People to look into this as a matter of urgency. I know the Secretary of State is concerned, as he said. I know Public Health England are also looking into this. So it's obviously important that when clinicians see these cases and worry that there might be a cluster, that they alert other clinicians so that we can make sure that they are identified if they're occurring elsewhere. And then quite rightly, we ask our experts to look into them and to see whether they can establish any link. We're not sure at the moment. It's really too early to say whether there is a link. But what I should say, as we said already this afternoon, is our advice to parents is that this sort of disease is very, very rare. If you are worried about a child who is becoming sick and not recovering, then do remember to contact 111, talk to your GP, or in an emergency, contact 999, because the emergency services in the NHS are there for sick children, and it's important for this and other conditions, although very rare, I must emphasise rare, that you come forward to seek treatment and diagnosis as quickly as possible.
Thanks, Steve. Chris Whittle.
No, I'm just ready to reinforce what Steve said. This is a very rare situation, but I think it is entirely plausible that this is caused by this virus, at least in some cases, because we know that in adults, who of course have much more disease than children do, the big problems are caused by an inflammatory process, and this looks rather like an inflammatory process, a rather different one. But therefore, given that we've got a new presentation of this at a time with a new disease, the possibility, it's not definite, we need to look for other causes as well, but the possibility that there is a link is certainly plausible. But back to Steve's overriding point, numbers very small. Key thing is, if parents are worried, then phone up and get advice. It's very rare.